Alrighty, guys, happy week 2 of this quarantine thing. So we are going to start reviewing for our AP test. I don't know if you guys have heard the news, but they are apparently taking out units 8 and 9, which is kind of a bummer because chapter 8 is essentially what we just did, which is disorders and therapy. So they're not going to test you guys on that, which is kind of annoying, but that's fine. And then they're also taking out social psych, which is also a bummer because I feel like you guys know that chapter really well, but there are a lot of terms in that chapter, so maybe it will also be a good thing. They're also looking into doing a 45-minute online testing. So they are canceling all the AP exams like in person. And so it's just going to look really different this year. I've heard rumors that there's not even going to be any multiple choice for the psychology exam, but that they're only going to do FRQs. So I don't know any of that yet. It's just a rumor. We will figure it out as we continue to get more news. They're going to send us out everything, I think, by April 3rd for more details. So I'm just going to move forward and we are just going to review like we normally would have, and then you guys can pick and choose what you want to take out when you are actually studying. So we're going to go all the way back to late August, early September, and we're going to go straight from the very beginning, which was prologue and history and approaches. Okay. Alrighty, so pre-scientific psychology. So we have Socrates and we have Plato. So Socrates and Plato believed the mind was separate from the body, so the mind continued to exist after death, and that ideas were innate. And so that this was pretty much saying that once you were to die, then the mind would continue to exist and float somewhere, and that you were also getting your ideas. You were born with the ideas that you guys have. Alrighty, then came Aristotle, and he was like, no, the soul is not separate from the body, and that knowledge actually grows from experience. And so for this one, this would be more of a nurture debate, whereas Socrates and Plato were more nature-based. All right, and then we have Descartes. The only thing they ever ask about Descartes is pretty much the animal spirits. And then also the idea of that immaterial mind and physical body communicated. And this is pretty much all that they would test you guys on. I feel like I'm missing something. Am I missing something here? Descartes. Sorry, not teaching in person has made my brain slow. Pretty much I'm trying to think what else they would say. Oh, they would talk about how mind and physical body communicated. And they would talk about animal spirits in the sense that maybe certain parts of our body, like blood or whatever fluids, meant something else. But there's something else when it came to Descartes. What is it? Okay, I have to come back to it because it's going to really bug me. But I will come back to this. Alrighty, then Bacon. Every time we ask about Bacon, they're only going to really ask about empiricism. And empiricism essentially basically means experimental. And the way you're going to remember that is the 2 E's. Okay, Bacon, empiricism, experimental method. Okay, then we have John Locke. John Locke, I feel like most of you guys know. Sorry, I'm trying to angle my computer so it's like not falling. Is going to be tabula rasa and blank sheet. So basically at birth, we basically learn from experience. So he would then be more of a nurture rather than nature person. Alrighty, so Aristotle was the only one that believed that mind and body were connected, whereas Socrates, Plato, and Descartes believed that mind and body were distinct. Alrighty, and then some ideas are inborn, so this is going to be your nature debate, is going to be Socrates and Plato, whereas the mind is a blank slate is going to be more of a nurture debate, which is Aristotle and Locke. Alrighty, now moving on to kind of more theories that were a little bit more modern, but it's like still kind of old. So we have structuralism. Okay, every time you hear the word structuralism, you want to think of 2 people. It is going to be Wundt and is going to be to injure. So when it came to Wundt, the thing that they're always going to ask about, aside from the fact that he's structuralism and the fact that he is the father of psychology, because Freud is not the father of psychology, even though he's super famous. So he's the first one because he's the father, because he essentially established the first psych lab. And then, do you guys remember what the lab was about? It pretty much was sensations and like tapping. So he would hear something and then he would touch a lever. And so basically it was talking about sensations and what he was experiencing. So he was the first psych lab. Okay, when it comes to structuralism, you also want to think of introspection. So introspection is going to be mostly tied with Tittinger. I feel like that's who they're going to usually give credit to. So Tittinger is always going to be structuralism and introspection. And introspection is looking within self. So, really talking about what am I experiencing? What am I feeling? And so the activity that we did in class that day, all the way back in August, was the gum activity. Sorry, it's really hard to write with this. So remember, we had to close our eyes and then you'd chew the gum, and then everyone had to say at least one word that described what they were experiencing in their mouths, which is being introspective. And so it was talking about objective sensations. And so that is also a problem in psychology because we all have different sensations and like what we're experiencing. Also, some of us couldn't have the vocabulary to like beyond chewy, minty, fresh. We like ran out of words to describe gum. So this theory went away, and then through this theory, we had functionalism. So functionalism, they're probably always going to give to James. So James has two contributions. It's always going to be functionalism, and then what is the other one? Yes, shout it out. Okay, good. It is the first textbook, which I will get to in a minute. Okay, so functionalism wasn't so much about like what you were experiencing, like chewing the gum of, I'm experiencing freshness and minty and chewy. It was more kind of why do you experience it? So how is it that we experience freshness and chewiness and mint? So it was the functions of the mind rather than the elements of the experience. Okay. So then again, William James is the one that you will always tie to functionalism. And then the first textbook, which you will sometimes need to know the title if they're to do a multiple choice, which we don't know if they're doing them anymore this year, is The Principles of Psychology. Okay, so first textbook. All right, then we have Freud. Freud, we've obviously talked a lot about. And so, let's see. Two words we always connect with Freud is going to be sex and the unconscious. Okay, then we have behavioralism, which is going to be Watson and Skinner. So this image is going to be the experiment with little Albert, which is Watson. And is this classical or is this operant conditioning? This is classical conditioning because he instilled fear in the little baby. Okay, then we have Skinner. His animal of choice was birds and rats for the Skinner box. And so he would be operant conditioning. So behavioralism had nothing to do with your unconscious or anything like within the mind. It was all about observable, measurable behaviors. So according to behavioralists, if I can't measure it or observe it or see it, then to us, it's not psychology. So very much opposite of Freudian's unconscious psychodynamic theory. Okay, so the experiment was pressing a lever, turning left or right, eating, mating, heart rate, dilation of pupils. We can all observe that and measure that. So those are all examples of behavioralism. All right, and then we have humanistic psychology. So humanistic is going to be like your hippies, happy love within yourself, growth potential, like live your best life, live your best self. So this is going to be your Maslow and your Rogers. It's all about growth potential, love and acceptance. Okay, and then quick review. Remember Rogers, his whole thing was age, which is acceptance, genuineness, and empathy. And then Maslow was going to be the hierarchy of needs, which we will get to in a bit. Okay, so then now to psychology today, we believe it's not just behaviors, not just mental, but it is both the scientific study of both behavioral and mental processes. All right, then we have the APA, the American Psychological Association. They are the largest organization of psychology. They're the ones that have come up with like the law and ethics of psychology, what degrees you need to have to do what job, what testings you have to do in order to get your license, blah, blah, blah. They're a big deal. So once you enter this field, we're all part of the APA. Okay, and then we have Darwin. So all your Darwin words, nature versus nurture. We have survival of the fittest. We have natural selection. Yada, yada. Dear, my computer, it keeps moving. I apologize. I can't get it to stay still. Okay. So then we know that our textbook emphasizes the 3 perspectives, the bio, psycho, social, cultural approach. And do you guys remember the video I showed you? It was Andrea Yates. She was the lady that drowned all 5 of her children. Instead of us just being like, oh, she's a monster, how could she do that? We want to kind of, explain her behavior from the 3 levels of analysis and also beyond. And so psychologically, she wasn't well. She had a lot of thoughts of, I can't do this. I'm not going to be a good mom. These kids are better off without me. When it came to biological, she did have depression. She had psychosis. So she was on medication. And then also having babies can alter your hormones a lot. And then social culturally, she had 5 kids. Like, that's a lot. That's a lot of stress. And then rumors have been that maybe her husband also wasn't really super helpful. So all of this equals the biopsychosocial approach. Alrighty, so that was kind of just overview. Now it's going to be your top 7 perspectives, which is going to sound very similar to what we just did. So quick review of your 7 hand mnemonic. Where's my hand? Okay, you have your, okay, your hand, your palm mnemonic. Thank you, sorry. Okay, you have your thumb. Where's my thumb? Your thumb, which is going to be backwards, looking at the past, looking at your unconscious. So it's going to be psychodynamic. Okay, we have your pointer finger, you point to your brain. So this is thinking, so it's cognitive. You don't really want to flip anybody off, but if you did, where did you learn it from? So it's going to be learning behavioralism theory. Then you have your ring finger, which is love, and so it's going to be humanistic. Then you have pinky and the brain, which is biological or neuroscience. And then you're going to have your palm, which is social cultural, because you're considering everything society, environmental. And then you're going to have your extra finger, which is essentially going to be evolution. So those are your 7 perspectives. Okay, so we have neuroscience, again, pinky and the brain. And so anytime you're talking about why we do things based off of our hormones, our genetics, our central nervous system, and especially our brain chemistry, it is going to be the neuroscience biological approach. So if any of the questions are asking about neurotransmitters or central nervous system, sympathetic, parasympathetic, anything like that, you're going to know it is a biological perspective. Okay, then we have evolutionary perspective. So this is trying to explain people and their inherited traits and basically how do we ensure our ancestors' survival. So for example, Homer Simpson, he's eating a lot of donuts. Instead of just calling him, oh, you're obese or whatever, the idea could be, well, maybe we can explain that because if he was to be on a deserted island, between him and a very small person, he's probably going to outlive and outlast that person because he has more cushion in his body. So maybe that is an evolutionary perspective to explain why he is eating the way he's eating. And so that is going to ensure his ancestor survivals and he's going to pass on to his next generation. Same thing here. Okay, and then with psychodynamic, again, it's going to be very Freudian. It's all about the unconscious drives, usually pretty negative, sexual, aggressive impulses, anxiety-provoking. A lot of the questions will come from childhood, so just unresolved conflict with mom and dad, any sort of childhood traumas, yada, yada, yada. Again, unconscious motives and conflicts are basically determinants of human behavior. And then he also believed that especially the unconscious drives were sexual and aggressive. And since we can't play those out, we can't actually fulfill all the things that we secretly unconsciously are driven by. So then it plays out in very different ways, like chewing ice if you're sexually frustrated, or being really type A and in a retentive now, because when we were younger we had to hold our bowel movements, and then we learned how to be in control, so then now as adults we were really controlling people. Oh, Freud. Same thing. Okay, and he also gained his understanding through clinical interviews. He was the first one that did the whole like lie on your couch, tell me about your dreams, and what was your relationship like with your mom, and blah blah blah. Okay, then again, we have the middle finger, which is behavioral and a learned behavior, so flipping somebody off. So I observe somebody else do it, from my friends, from my parents, from whoever, from TV, and then I do it again. So then it's going to be very behavioral because you can actually see it, you can observe it, and you can measure it. It's all about rewards and punishments. So that would be a operant conditioning idea, which we'll do that in our different chapter. But you continue to do well in school because you're getting rewarded, whether it's through praise or college or money. Some of you guys never text in class. Props to anyone who that would be. It's because you are afraid of the punishment of maybe a referral or a detention or being yelled at, and so then you don't do it. So rewards and punishments. Okay, and then we have cognitive, which is the fancy word for thinking. It's how we encode information. And so we just went over this, of the whole idea about, a lot of times our thinking can contribute to how we feel. And so our minds are really powerful. And so ideally, how you think about a situation is then ultimately going to change how you feel and what you do. And so we can change the way you think and make it more adaptive. That ends up being better for the overall human. Okay, Gestalt. This is more sensation perception. Just so remember the famous quote is that the whole is greater than the sum of its parts, meaning that we like things to be whole rather than breaking down into small parts. Okay, and then we have social cultural, which is our palm because it's encompassing everything. It focuses how our culture affects your behavior. And so even within the same high school, depending which period you're in, depending which teacher you have, depending whether or not you have friends in that class, we're going to act really differently in each one. Some of you guys might be consistent. Some of you guys might be more outgoing. Some of you guys might raise your hand more. So it's just interesting that even though a lot of us want to be really independent, we're ultimately affected by society. I mean, look at us right now. We're all on lockdown. And some of you guys might be looking at social media a lot, and that actually is affecting your mood, whether it's good or bad. Some of you guys might be, affected by the way your parents are reacting. And if they're really anxious about what's happening, then that might make you more anxious. So if they're really calm, then you might be really like, oh, whatever, this whole thing's happening. So it's kind of like we're heavily affected by those around us and society, family, friends. And so social cultural is a huge part of psychology. All right, then we have humanistic, like we talked about. All your keywords include positive self-growth, self-actualization. And so here's just a quick review of your hierarchy of needs. It's like really difficult with this, okay? Your most basic need is going to be biological or physiological. Once you are satisfied your hunger, thirst, and elimination of waste needs, then you want to feel safe. So having shelter, feeling safe in your own home. Then you want to have belongingness and your love needs. So we want to have friends, we want to have family, we want to have loved ones. Then we have esteem needs, which is pretty much we want to be respected. We want to be seen as competent. And then the last one is going to be self-actualization, where you reach your full potential. And then the newest one on top is going to be transcendent, transcendence, where you're just kind of like one with the world. It's very philosophical, very transcendentalism like. It's like, oh, so that's your hierarchy of needs. Okay, when it comes to therapists, we want to use active listening and unconditional positive regard. According to Maslow and Rogers, we pretty much need to be accepted for who we are, regardless of our flaws, our mistakes, our failures. And so ideally, we would get those from our parents, our loved ones, our peers, our teachers, our therapists. And so that would help us reach our full potential. And for ourselves too. Okay, so again, kind of going through current perspectives. Alrighty, now we have different subfields of what people do. So we have biological, developmental, cognitive, personality, social. We have so many more different occupations. But biological, your main focus is going to be the links, figuring out the links between brain and mind. Developmental is going to be you studying babies, children, adolescents, young adults, adulthood, and the elderly. Cognitive, how do we think, perceive, and solve problems? Personality is going to be like, are you outgoing? Are you extroverted, introverted? Are you type A, type B? Are you an ENFP? Are you an INFJ? Are you an Enneagram 1 through 9? Blah, blah, blah. So all those personality tests. Okay, social psychologists are going to explore how we function being individual with also a society of people, and how sometimes we are more likely to help if we're alone rather than surrounded by other people. That's our whole social psych chapter. Okay, when you are, we'll go here. All right, then kind of again, more subfields and how it's applied, like more of like the titles of what we want to be one day if you decided you want to stay in this field. So again, a clinical psychologist is the highest you can be in this field. This person has a PhD. So if you're a clinical psychologist, you are going to assess and treat people with psychological disorders. So they can do anything. They can work in hospitals. They can work in schools. They can have their own private practice. So this is like the top. If you want to be called Dr. So-and-so, this is where you would be. Starting salary probably around 80,000, I think. And so they are going to be the ones that are going to treat the severe mental illnesses. Okay, counseling is going to be essentially more like a marriage family therapist, like what I do, or a counselor. They're called licensed professional counselors. We treat people with, everyday problems, whether it's marriage, family, anxiety, depression. We can work with severe mental illness as well, but normally we would refer to either a psychiatrist or a psychologist, but we can do it as well. We don't get paid as much as a clinical psych, and you're not called Dr. So-and-so, but counselors are very, very common. Counselor is the same word as therapist. Then you have educational psychologists. They are the ones that are going to deal with academic settings. So the whole, we don't ever grade with red because it's psychologically damaging. Or, when we're putting our desks, like active learning is putting students into pairs, or putting them into little pods so that way they can interact with each other. It's trying to figure out what's appropriate learning environment to help engage students in their learning. Okay, industrial organization is a fun one. It's business and psych. So if you are really into business, or you want to do profit and consumerism, and you want to, or HR, and you also want to tie in psych with it, that's a really cool place to go. They're the ones that have certain restaurants be a certain color, like orange and red and yellows make you salivate. So then you have really popular restaurants like, In-N-Out, McDonald's, Del Taco, Chick-fil-A, I think Raising Cane's. So all the ones that have reds, yellows, and oranges are going to basically make them more profit because it drives people to salivate to then go and buy their delicious food. Okay, so then clinical psychologist is probably the biggest field just because it is the highest that you can get to in our psychology field. All right, so again, the difference, just probably what they're going to ask you most, is a difference between a clinical psychologist versus a psychiatrist. So a clinical psychologist, again, is a PhD. They go through school for psychology. They treat all the mental illnesses out there. A psychiatrist goes through a medical program. So they're essentially your doctors and they have an MD, but the main thing is that they can prescribe medications whereas a clinical psychologist cannot. So if someone comes in with depression and I think that they need to be on antidepressants, I'm going to refer them to a psychiatrist who then will actually write them the prescription, where then they can then take it to CVS to get it filled. Whereas for me, I can't write a prescription. I can just refer them to a psychiatrist. So those are the main differences. Alrighty, and then just emerging fields, we have forensic psych. It's anybody wanting to work in the criminal justice system. So if you're really into CSI and like criminal minds, this might be the field for you. It tends to be a really needed field. You have to have a pretty thick skin. Sometimes you can work in the prison system. And so trying to figure out whether or not somebody is sane or not sane can be part of your job, whether or not they're competent to sit for trial, trying to find some of the motivations behind why people, engage in criminal activity can be all part of this job. Alrighty, and the last one is a health psychologist. So this is where you're going to focus on, like exercise or obesity or diabetes. Sometimes with health psych, you can be the therapist or psychologist on, at the hospital who is treating cancer patients or helping the families of cancer patients handle their grief and loss. So it's a huge range that you can go into. So for psychology review, any of these positions, you want to start with a BA in psychology. And then once you're in grad school, then you can kind of decide which specific field that you want to go into. So that wraps up our review of Prologue for History and Approaches. Hope you guys are doing well, and then I will make the next one soon. Miss you guys. Bye.